Dr. Satanshu Mathur.
Thanks, Dr. Sabachi. Thanks, Dr. Nimble, for allowing me to speak here. I'm sorry for the disorder change. You all know this is the most dreaded disease which we all don't want to happen in our hospital, but it is not in our head. Next, please. Next slide. This is the thing which is always a nightmare for a doctor. 5 possible factors alone or in combination, please. Yeah. 5 possible factors alone or in combination are responsible for this endophthalmitis. Patient personal hygiene, contaminated surgical supplies, faulty sterilization procedures, inadvertent touch, and environment. If we can take care of these 5 possible factors, we can have 0 endophthalmitis in our hospital. Next, please. What are the preoperative risk factors? Number 1 important thing is meticulous external eye examination. And we should see for blepharitis, conjunctivitis, lacrimal duct obstruction, recent immunosuppressive treatment patients taken, eyelid abnormalities like entropion, and most important is the diabetes. Next, please. Next slide.
Yes.
Blood sugar fasting less than 120 mg% and random less than 200 mg%. These are the AIS guidelines we can quote in the court of law. Conjunctival culture, not necessary in every case, but in chronic infection and recently healed corneal ulcer. Syringing should not be routine, but if you have to done, not on the same day. If there is a regurgitation of pus on pressure over the lacrimal sac, then no surgery should be done. Next, please. What should be the instructions of the patient before surgery? 4th generation broad spectrum antibiotics should be used 4 to 6 times a day before surgery and on date of surgery. Patient should be instructed to wash face, hair, and male should shave properly, and they should wear clean clothes before coming for surgery. What should be the instruction to the patient? After that, the instruction to the staff. If biometry has to be done on the same day, use immersion method to avoid contamination, not the contact method. If there is long list of surgery, diabetic patient should be given preference in OT list. Next, please. Your staff should be instructed to clean the brow region, not only the eye, but the brow region, lid margin with 10% iodine solution. The most important thing is iodine 5% 2 times topically 5 minutes before surgery. It is better than using antibiotic 1 day before. This is very, very important. Change of stitch close the OT. Cap should be properly held in the head. Mask should, especially in the corona time, we should use the disposable mask for the patient, doctor, and staff in the OT. We should change the outside mask in the OT. Next. Slippers should be changed for the OT. Gloves should be changed after each and every case. Gown should be changed after 5 to 6 cases. And OT members with URTI, skin infection, should not be allowed to enter the OT. Scrubbing is the most important. Chlorhexidine or any antiseptic soap up to the elbow. Then we should wash with the povidone iodine liquid scrub and follow proper technique for 5 minutes. This type of chart should be hanged over the scrub area, not for you, but for your staff to know how to scrub, and they should wait for 5 minutes there. We should use the proper technique for the gloves. Next. Draping is very important to prevent the infection for the lid area. The practice of trimming lashes is not recommended nowadays as proper draping is done. Next. Monitoring surgical supplies. We should check the expiry date, packing, whether it is intact or not, of all the supplies used intracamerally. Irrigating fluid, as we all know, the irrigating fluid is the most culprit in all the cases of endophthalmitis. So we should note the batch number of the irrigating fluid. Physical inspection should be given against light for any foreign particles. Preferably, we should use 1 bottle for 1 patient. No double autoclaving. Preferably keep infusion bottle 24 hours after the use. If there is infection, we can go for the culture of this infusion bottle. Microbiological workup and approval for each bottle batch wherever it is practically possible. Next. Installation during surgery. Phaco sleeve and tip should be cleaned after each and every case. There is no evidence that using antibiotic irrigating fluid during surgery can help, so there is no use of it. Next. Subcon antibiotic given at the conclusion of the surgery is important. Intracameral injection of antibiotic, it has been recommended nowadays, but not in all cases. We can use in high-risk cases. Wound should be watertight. If there is a complication like PCR, we should manage this properly, effectively. Next. Post-operative should be visit first day, 7-day, and 15-day, and then SOS. Examination of slit lamp on every post-operative visit is very important. Topical broad-spectrum antibiotic for 7 days. Oral only in high-risk cases. Topical steroid we give 15 to 20 days in tapered dose. Painkiller is SOS. Protective glass for 7 days we give. If there is infection or doubt of infection, we should talk to the patient and relative and institute prompt treatment appropriately. We should wait for infection to increase. We should start treatment immediately. Do not panic. If you are working in a hospital, you inform the higher authorities. Next, please. This is be covered by other speakers. Next, please. OT layout, this has been discussed by others, but most important is the culture sensitive once in a month. We should create the sample for floor, wall, OT table, and AC and phaco machine, and should keep the record maintained. Next, please. Water tank is very important. We do not take care of the water tank from where the water is coming, but is the most common contaminated part. We should clean the water tanks very frequently. We should have separate water tank for our OT. Next, please. This is a very important checklist. Every week, daily, weekly, and monthly. Daily checklist, who checked the preoperative medicine, who checked autoclave, strip register, who filled the drum, who checked clarity of the injection, who did preparation of the patient. These are important things. We should check it daily. Next, please. Who cleaned the equipment, who put on the UV light, who replaced the bed sheets. This should be made outside your OT wall, signed by the OT nurse who is in charge, and should be signed, countersigned by the doctors. This helps your staff to be kept on the toe. They are aware the doctor is going to sign it. They are going to know what care they should take care of the OT. There will be no negligence now. Next slide, please. These are weekly checklists. List of medicine, who checked it, who checked the expiry, who submitted autoclave report, who did the cleaning on Saturday, Sunday, who cleaned the wall, who cleaned the sink. They should also be signed by OT staff and countersigned by doctor. Next, please. Who cleaned the instrument, who cleaned the ACs, who cleaned the scrub area. These all things are mentioned and signed. You keep in the file. This will help also you in the court of law when you can show them, the judge, that you are taking all the precautions and very precisely. Next slide, please. Who checked the expiry date of medicine? Who cleaned the microscope? These are the weekly checklists. Next, please. And this is the monthly checklist. Who tried the swab culture from the OT? Who cleaned the OT, all the furniture? Who didn't charge the waste, washing of the OT on last Saturday? These things are always helpful, keeping your staff on toe and making aware that they have to check it. Next, please. Who cleaned the drum? Who cleaned the windows? Who cleaned the storage shelf areas? And everything should be signed and documented, kept in the record. Next, please. If you take care of all these things, next day your patient will be smiling, and big thanks to you. Thank you, Dr. Savachi. Thank you, Dr. Nimble, for including me in your section course. Thank you.
So thanks, Dr. Sathanshu, for the nice and brief presentation on these things. And what you have again re-emphasized, the daily, weekly, and monthly schedule has to be maintained and to be properly documented also. Unless you document, no one is going to believe what you are doing or not doing. So for your safety purpose and for medical legal purpose, all the things have to be properly documented.